WFM 91.7.
A very beautiful morning to you. Once again, thank you so much for tuning in and joining us this morning on the program Radio Doctor right here on Women Radio WFM 91.7. This is Nigeria's first radio station for women and their families. How are you today? I hope you're feeling great today. I hope you woke up on the right side of your bed and you're feeling healthy today. All right, so Radio Doctor, yes, is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise right here on Women Radio WFM 91.7. Radio Doctor comes to you Mondays through Fridays from 10 a.m. All right, so today on Radio Doctor is on women's health, and women's health today on Radio Doctor is supported by ACT Foundation. My name is Rose Yusuf Kaiser, and our Radio Doctor for today is Dr. Collins Abolaje, and he's an assistant medical director and fertility physician at St. Ives Specialist Hospital. Good morning, Dr. Abolaje. How are you today?
Good morning, Rose. I'm doing well.
Okay.
How are you?
I'm okay. I'm good too. How's your past week been?
Well, it's been beautiful. I mean, we're approaching the end of the year, so basically a lot of fatigue has started to set in anyway, the end of the year fatigue, and of course everyone is looking towards the festivities.
All right, but doctor, we asked you this question though. Why is it that sometimes towards the end of a particular season or a particular thing or day, our body just automatically assumes that tired position? Sometimes
position, right?
It just feels like it just works naturally, like it just comes.
Yeah, I think it has to do with our minds. Basically, you put in your very best. Now, basically, the mind is always geared towards a start and a finish. So basically, that January is the start of the year. Of course, yes, some level of fatigue will still be there, but then, of course, you're geared up to be like, okay, yes, let me start putting in my very best. Let me do some of these, my resolutions and all of that, and just try to be my very, try to assume a new personality, dedicatedness to work and everything and every other thing that you have actually had, like a physical attitude towards. So basically, now we're approaching the end of the year. So that finish, that ending point mentality starts to set in. Basically, it's been 11 long months, and now in the 12th month, I just want to just pull back a little bit from some seriousness, work and all of this, and just enjoy myself. So you put in the good work, so it's time to now actually relax. So basically, I think that is what happens. And I feel it's a normal phenomenon. It also exists even in the hospital during the week. You find that studies have shown that doctors put in their very best from Monday to Thursdays, and on Fridays.
It's not only doctors, everybody like this. Because everybody, once it's Friday, once it's 12 p.m. on Fridays, like everybody's work is already over. Please, let's just be going home.
Exactly. It's just like somebody starts turning off the lights in the workplace, like from that 12 o'clock, like on our minds, everything just starts.
Well, it's all good. It's just part of us being humans. All right, Doctor, thank you so much for joining us today on the program. So, if you just joined us, this is Radio Doctor, and it's 9 minutes after 10 right here. So, Dr. Abolaje will be here consulting and advising on egg donation and what you must know. All right, so that's what we're going to be doing today, egg donation and what you must know. So if you have questions on egg donations, you have concerns, maybe you have heard about it, maybe you have heard something that you're thinking, this cannot work. It not be me go do this one. But hey, it's this is a very great platform for you to come. Maybe disabuse your mind on some of the things you have heard and get good information and be well educated about this egg donation and what you must know. And coincidentally, I was talking to my parents, I think day before yesterday. We were talking about surrogacy, we were talking about egg freezing, and all of that. And my mom was just, what are you saying? So you mean, Mommy, where are you living? This is 2023. These things actually happened. So to think that a lot of people are opening up to all of this. So, but I'm excited that we're talking about this today on Radio Doctor. All right, so our phone lines are open. 07000 917 917 is the number to call. Send us a text or a WhatsApp message to 070 317 56537. Go log on to our website www.wfm917.com. Download our mobile app WFM917. All right, our social media platforms are always there for you. Facebook, Instagram, and X, that's Twitter, and of course YouTube at WFM917. So follow us on all our social media platforms and drop in your contributions there too. All right, so yeah, this is Women Radio, and 11 minutes after 10 right here, we have Dr. Collins Aboloje, and he's consulting and advising on egg donation and what you must know today on Women's Health right here on Radio Doctor, supported by ACT Foundation. All right, Dr. Aboloje, let's head on straight with the conversation for today. Now, let's start off with egg donation. What is egg donation and how does it work?
Okay, so basically, I would start by giving some small definitions, and that, of course, sets the mood for the for the discussion. Okay. So basically, a donation, first of all, is a gift. Okay, it's a gift to a charity or a humanitarian organization, or even towards a particular cause. And donation can exist in different forms. Okay, so but in this respect, okay, we're talking about a donation that is meant to satisfy a medical need. So donations can exist, especially medically, in the forms of either organ transplant, organ donation rather, or blood donations. And of course, in this context now, eggs. Okay, eggs in this case do not mean the eggs that are available on the street, chicken eggs. No, we're talking about human eggs. Okay, we call them oocytes. Okay, so basically, egg donation now only exists for people that are up for IVF treatment. So basically, nobody can decide to just donate eggs to somebody that's trying to get pregnant, in the bedroom. No, this is only available in the context of IVF treatment. For people who do not know what IVF is, it is in vitro fertilization. And what that grammar simply means is fertilizing the eggs of a woman with the sperm of a man in a lab. Okay, in a lab, not the one that happens inside of the body. That is natural fertilization. But this one is happening in the lab, done by an experienced specialist, okay, who of course is called an embryologist. So basically, they are the ones who would do all of those fertilization procedures and all of that. So basically, egg donation only exists for IVF. This is just to state it out there. Now, what is egg donation? So egg donation is the act of using eggs, okay, oocytes donated by a donor, of course, for the IVF treatment of a woman, okay, of an intending mother, which is a woman that is not yet a mother, but she's willing, she wants to become a mother, for the IVF treatment of that woman, because she's unable to produce eggs. So basically, you would rely on the eggs produced by a donor to do IVF for her in order for her to get pregnant. So let me take that again. Egg donation is the act of using eggs donated by a donor, of course, for the IVF treatment of an intending mother who's unable to produce eggs of her own. So for egg donation to take place, okay, 2 things are required. Okay, the woman must, of course, or 3 things rather. The woman must be, of course, unable to produce her own eggs. Of course, there are still some indications which I will speak about shortly. Okay. And of course, the woman must be doing IVF. It will only be done in the case of doing IVF. Okay. Yes. So there are some indications. Okay, just to state it. Okay, there are some indications for a woman to opt for the use of egg donation or opt for donor eggs. Okay, during an IVF procedure. Now, most of the people that are candidates for the use of donor eggs for their IVF, okay, are women who either they do not have a functional ovary, okay, or they have a functional ovary, but something has also made them not what's the word now? Has made it not possible for them to be able to produce eggs anymore. So basically, for women who do not have a functional ovaries, these are women that most likely they would have either removed their ovaries due to one disease process or cancer, as the case might be, or women who have attained premature menopause, or we call that premature ovarian failure, where the ovaries actually stop working before the age of 40 for some women, and of course women who have now actually attained menopause. These are women, of course, between the ages of 45 and 55. That is what the statistics show, that women will attain menopause between the ages of 45 and 55. So for women, of course, who maybe they got married late, and just at the time they were getting married, they attained menopause maybe at the age of 45, and of course they are still desirous of having a child. So such women cannot be able to produce eggs anymore because they've attained menopause. Menopause is simply the physiological cessation of all reproductive function, okay, by the shutting down of the ovaries. It is what happens. It is what the way God has designed the woman, that at a particular time our ovaries must shut down. Menses will then stop. The ovaries actually play two functions in women. Okay, they produce the eggs of the woman, and of course they produce the hormones. The estrogens and your progesterones are produced from the ovaries, and this is what will, of course, stimulate the womb, okay, to see menses. Okay, so basically once the ovaries shut down, those two functions will be lost. So these are for women, of course, who have natural, who they are presumed not to even have ovaries anymore. And even for some women, they do not even have ovaries. They were born without ovaries. So such women will not be able to get pregnant. As a matter of fact, they will not even see menses. Exactly. So these women, of course, if they are desirous of having a child, of course, they would have to opt for egg donation, have to opt for the use of donor eggs for an IVF treatment, for their IVF treatment. And for other women, okay, they might have ovaries, but the ovaries themselves, okay, by reason of maybe they have a risk, they are at a risk of transferring an inheritable, genetic disease. So basically, it would be better for them to use egg donors. And for other women, of course, maybe by reason of the fact that they are above the age, they are above a certain age, above the age of 40, usually doctors will start to advise the woman. A woman who comes in for IVF treatment, okay, a woman who has not gotten pregnant and she comes in at the age of 40, 41, usually will advise the woman to consider the use of donor eggs, okay, eggs that are donated for an IVF treatment. The reason, of course, being that, from the age of 30, eggs starts to decline, okay? And by the time the woman has crossed the age of 35, both the quality and the quantity of the eggs rapidly decline. And by the time she's gotten to the age of 40, at that age, it is presumed that the woman already has, of course, chromosomal problems, okay, arising in the egg. So basically, you don't want to use such eggs for IVF treatment because it could, result in a failure increase in the failure rates would increase, in that IVF treatment for that woman. And of course, you can even put her at risk of even having spontaneous miscarriage. Even if the IVF works out, she can easily develop, have a spontaneous miscarriage, especially because of the quality of the egg, quality of our eggs at that age. And same thing also applies to women who are even trying to get pregnant naturally at the age of 40 and above. Women can still get pregnant naturally at the age of 40 and above, but they stand a very high chance of having a spontaneous miscarriage. So basically, to run away from problems that, inheritable genetic diseases or even problems with chromosomal abnormalities present within the egg, so basically women will be advised to use donor eggs. These are for women that still have their ovaries intact. Okay? Yeah, so these are some of the indications. So like I said, you can't do egg donation IVF without the presence of a donor, an egg donor. So someone has to donate that egg. So the people who donate those eggs that are used for IVF, okay, these people are called egg donors. Now, so who is an egg donor? An egg donor is actually a young woman within a specific age range, usually between 20 and 30, who is able and who has voluntarily given their consent to donate their eggs to be used to help an infertile woman conceive. So that is who an egg donor is. So it is just, these are just background information just to see, so that at least as we proceed in the conversation, it becomes clearer and clearer. Yeah.
All right, thank you so much, Dr. Abolojay, for giving us a background information of, egg donation and how it works. All right, so this is 19 minutes after 10. You can do what's a call in right now, and let's get to hear your thoughts, your concerns, your questions on egg donation. 07000 917 917. Send us a text or a WhatsApp message to 070 317 56537. This is Women Radio WFM 91.7. Nigeria's first radio station for women and their families. And of course, this is the program Radio Doctor, where doctors get to advise and consult for free right here on Women Radio. All right. So, Dr. Bolejo, while you were giving that explanation, you talked about, women unable to produce her own eggs or born without ovaries.
Ovaries,
Now,
yeah.
when you say unable to produce her own eggs, I know we were taught in school that once a baby is formed, in the womb and it's a girl, she's already born, or she's been given the number of eggs you will need for a lifetime.
That she can possibly
Yeah.
produce. Yeah.
So how is it unable? How do we get to the stage from you have the eggs that you're supposed to have all through your life to be not able to produce these eggs? How do we get there? Or how do we get to be born without ovaries when we have all of these things when, we're still being formed in the womb?
Okay. So now basically inside of the womb of
Yeah.
of a pregnant woman, who's carrying a female, fetus or a child,
Yeah.
So basically that female child, already has the eggs present within the ovaries, even inside of the womb of her mother, So at the time of birth, a woman actually has the capacity to be able to produce, at the time of birth, inside of the womb, inside of her mother's womb, she has like 2 million eggs. By the time of birth, she would have at least at about 1 million, But of these, only 700,000, by the time she attains puberty, that is the time of release, because they stay dormant, they are not being produced, they are not being released, so they're just there inside of the ovaries of the lady. So by the time that lady, that young girl gets to puberty, that is when the eggs start to be released. So at that time of puberty, she has the capacity to be able to produce 700,000 eggs, before she attains menopause. But of that 700,000 eggs, she would only be able to ovulate roughly around 400, thereabouts. If we are to do the math very well, the average age of people to see menopause is between 45 and 55. So let's take the upper limit, which is 55. So and then maybe the lady starts seeing her menses, let's just say maybe at the age of 12 or 11. So if I to do the math very well, and she has to ovulate 1 egg every month. For 12 months, so basically she has like 12 ovulates, she has 12 eggs every year, times the number of years that are left from that age of 11 down to 55. You can see that the math roughly will be around 400 and something eggs thereabout, if I'm not mistaken. Anyways, doctors were not so good with mathematics, but were very, very good with biology and every other thing. But anyways, yes. So what happens is that in her entire lifetime, she will only be able to produce at least 400 plus eggs. That's it. The remaining number, the 600,000, blah, blah, blah number of eggs would undergo apoptosis or atresia, as the case might be. So she will not be able to release them. They would more like disappear from the ovary. Let's just use that layman word for people to understand. So basically, for some women, because they do not have ovaries, they were born without ovaries. So they do not have that potential. They do not even have that function. That statement of having a particular number of eggs in their ovaries does not even exist for them, because they don't even have the ovaries. They don't have it. It's not like the ovaries are there and they are not working. No, they don't have it. They were born without the ovaries. So of course, these are developmental anomalies. So for such people, of course, they would require donor eggs. So as it stands, like I said, as the year goes by, the woman keeps ovulating. Different things can happen, There could be some acquired conditions that will result in the damage of the ovaries, and of course, the potential for the ovaries to work optimally will be lost, and of course, these would, of course, result in problems for the woman. So I don't know if I've been able to answer that question correctly, or if I missed something out, you can just please remind me so I can speak more about it.
Right, I think for the sake of our time, that will definitely serve. All right, so thank you so much, Dr. Bolejo, for actually clearing that up for us. All right, so this is Women Radio, 24 minutes after 10. Let's head on with the conversation right here with Dr. Bolejo, and we're looking at egg donation. All right, that's what we're looking at today, egg donation and what you must know. Now, Dr. Bolejo, who can be an egg donor, and what makes you eligible for this? Because we've been able to establish why, some people actually need these eggs that are being donated. All right, some women rather will need these eggs that are being donated. You mentioned IVF, you mentioned not being able to produce your own eggs or born without ovaries. I mentioned age also, and all of those factors that could make a woman open to receiving egg donation. Now, let's talk about who can actually donate an egg and what makes you eligible to do this as a woman.
Okay, so now, any young woman, okay, there are some criteria for that must be fulfilled before a woman can be said to be an egg donor. Basically, there are some selection criteria. And before I go deep into that selection criteria, it is important that we know that, of course, there are two types of egg donors. And like I said, just to recap, egg donors are women who are voluntarily consented to donating their eggs in a bid to help infertile women get pregnant through IVF, of course. So basically, there are two types of egg donors. We have anonymous egg donors. These are donors that their identities are concealed. Basically, their identities are not known, just for anonymity's sake. If anonymity is maintained in this type of arrangement where the donor, the recipient, the person that is to receive the eggs of that donor, okay, does not know the donor does not know the person. And then, of course, we have direct egg donors. Direct egg donors are donors, of course, who are relatives or friends. I mean, their identities are known to the receiving party, that are known to the recipient. Okay, so basically these are people like sisters, relatives, or friends who have voluntarily consented to donating their eggs. So now to jump to the question, okay, there are some selection criteria. Different organizations or different health facilities actually have. There will be an addition to this checklist that I want to give to you, but of course these are just the basic selection criteria. Of course, the donor must fulfill an age criteria. First of all, the age of the donor must be between the ages of 20 and 30. Okay. The next thing is a physical evaluation criteria. Of course, for the physical evaluation, the donor must fulfill certain criteria like the BMI, body mass index. So the body mass index of that donor must be within the normal range. Okay, what it should be. The donor should not be underweight or overweight or obese. The donor must be within the normal body BMI. Okay, yes, and of course, for some lifestyle checklist, of course, the donor should not be involved in taking alcohol, smoking, tattoos, using of recreational drugs, all these other drugs that are being taken by youths these days and everything. Shouldn't be involved in all of that. Of course, then talking about investigative criteria, basically the donor would have to undergo some tests, some blood tests, blood group genotype, infection screening, HIV, hepatitis, chlamydia, gonococcal infection. All of these things will be screened for. Okay, and of course, a hormone assay has to be done for that donor to be sure that the donor is not having any hormone imbalance, and of course, an ultrasound scan will be done also to check that the ovaries are normal, and of course, she still has eggs. Okay, and then. And there's what we call a phenotypic evaluation. What that simply means is that the donor has to bear a little bit of resemblance to the recipient. Now, what this resemblance talks about, of course, it's difficult to find somebody who looks exactly like you. So basically, there are some markers we just take, like the skin color, the height, the color of the iris, the color of the hair, and so these are some phenotypic markers that we use, okay, as a selection criteria, okay, for donors. And then lastly, of course, the psychosocial status or the psychosocial criteria, where the donor should be psychologically ready to donate. Yes, and she shouldn't be coerced. So she has to have what we call an altruistic motive, okay? Selfless motive, not for some selfish reason or some, the donor truly wants to by herself, not being forced by anybody, agency, or anybody say you must donate. No, she has the put. In fact, even if a donor comes into the hospital and she listens to all the conversation and she has been counseled and everything has been done, and she still decides not to do it, nobody's going to force her now, stay now. No, we don't do all of that. So it has to be voluntarily, okay? So these are some of the psychosocial criteria that has to be fulfilled. Like I said, some other facilities also they add some other things to this based on their own personal preferences, okay? But these are the main criteria that are used in selecting a donor. And of course, there has to be a consent, like I said, a consent and even a legal aspect of everything. Just to secure, because the truth is, being a donor, of course, there could be some legal issues that could arise, like we said. So basically, it is very important to have this checklist and just to check these things.
All right. Thank you so much, Dr. Bolaji, for that. 30 minutes to 11 right here on Women Radio WFM 91.7. And we are talking about egg donation and all you need to know. All right. Do want to call us up on 07000 917 917. Now send a text or a WhatsApp message to 07031756537. All right, this is Women Radio WFM 91.7 and this is the program Radio Doctor. And today on Radio Doctor, we are looking at women's health. Hence, we're talking about egg donation. Of course, when you say egg now, it's not just the egg you find outside anywhere. Like Dr. Bolaji said,
Exactly.
it's a woman's egg that we are talking about right here. All right, let's pick up this call before we continue the conversation. Hello, good morning.
Hello, good morning, WFM.
Hi, good morning to you too. What's your name? Where are you calling from?
Yes, this is Yusuf Olamile Kwadedewa. I'm calling from Lagos.
All right, Yusuf, thank you so much for calling. Go ahead, let's hear you.
So, I want to ask the doctor, what is the success rate of that egg donation procedure? Does it fail at time that the patient will now have to pay another? I mean, the person has to pay another money for another procedure. And number two, can infections like STDs, all these stuff, destroy the quality of eggs or the eggs in a woman as they are growing up? So those are my two questions.
Okay. All right. Thank you so much, Yusuf Olamilekan, for calling. All right, Dr. Bolaji, did you get him?
Okay, yes, I got it.
All right.
So now, basically, okay, people who opt for IVF treatments, okay, they are actually offered a success rate, okay, of the procedure, okay, and usually the success rate usually range, it differs between clinics, okay, and largely in this part of the world, success rate is still somewhat around 30 to 40%. Thereabouts. Okay, but more people will get pregnant using donor eggs than using their own eggs. This is what studies have shown. As a matter of fact, the success rate of IVF treatment for people who opt for egg donation IVF, of course, rises even as high as 55%. Yes, worldwide. Yes, it is. This is, and of course, I'm pretty sure. Saying this right now, a lot of clinics, a lot of people who are actually listening, who are medical practitioners can concur to this statement that, of course, the success rate that they've obtained in their clinics usually is higher. When you have to sample the people who use donor eggs. Yes. So to answer that question, of course, there's a higher success rate for people who use egg donors, of course, and donor eggs for their IVF. Of course, this rises as high as 55%. Yes, and yes, for IVF in itself, whether you use donor eggs or use your own eggs, there's still a chance that it fails. As a matter of fact, more people truly will fail, okay, in their IVF journey than succeed. That is what we are offered, okay. Even as clients, okay, basically they have to be privy to this information that, of course, a lot of people will not get pregnant from IVF than they would. Yes. So, but of course, the decision that has to be made in the course of the evaluation of the couple also matter. So in this case, of course, you find people that you're telling to use donor eggs by reason of their age, and then they're like, no, doctor, I still want to attempt it because it gives them a sense of fulfillment that, oh yes, I tried my very best, I still tried using my own and all of that. And if the procedure doesn't work, of course, these people would fall into that category of people who tried the IVF and it didn't work for them. But of course, a lot more people will get pregnant using donor eggs. And of course, there are still some other factors that will make an IVF work or maybe that will also make it to fail. Okay, of course, it is not just about the quality of the eggs and all alone. Of course, you also have to talk about the integrity of that endometrium. Is the endometrium receptive? What about the quality of the sperm? Yes, because if the quality of the sperm equally is not good and you're getting a very brilliant or an excellent quality of egg, okay, from the donor, of course, chances are excellent that there will still be somewhat bad embryos, by reason of that bad sperm that was used. Okay, so it is important that all of these are checked, okay, when doing the procedures, because they can actually affect the outcome of the IVF procedure. Yes, so that is to answer that question as to if using donor eggs can still result in a failure. That yes, it can, but of course, more people will get pregnant using donors than using their own eggs because there are still some other factors that can, assure success in an IVF procedure. Second question he asked was about the infection. If infection can result in the damage of the eggs of the woman. Well, I have not seen any study that actually show that infections per se can result in the damage of the eggs of the woman. Infections can damage, can result, maybe there could be a blood infection, okay, of the ovaries, okay, that would affect the potential of that ovary to work optimally. Yes, but not about the eggs themselves. Infections themselves, I have not seen any research or anything on that yet. Anyway, so, but from my own knowledge, infections cannot damage the eggs. Rather, infections can, of course, affect the ovaries and cause problems, in that ovary, but not the eggs themselves damaging. So it can just maybe affect the potential of the ovary to work the way it should, to ovulate and all of that, by reason of an infection that is ongoing in there. Exactly. So, but about the eggs in itself, of course, infections, they can't affect the eggs.
Okay. All right. Thank you so much, Dr. Abolaje, for answering Yusuf Olamilekon this morning. You can also call in on 07000 917 917. Send in your questions, your thoughts, and of course, your concerns to 070 317 56537. All right. Through text or WhatsApp messages. All right, Dr. Abolaje, let's head on to medical screenings involved in becoming an egg donor. I think you mentioned something of that earlier, but just dwell on this a little. What are some of the, medical screenings that an egg donor could actually go through? And for a fact, I like the fact that you said, the egg donor has to be willing and not motivated by some sort of, maybe reward or something like that. So exactly. The screening parts right now, what are some of the screening, screenings that are involved in becoming an egg donor?
Okay, so basically once the donor's testing, walks in through the door, okay, first of all, after every other thing has been done and all of that, spoken to the nurses, of course, tests will be done for them. Okay, we want to check their blood group, their genotype. Okay, we want to also check the infection screen panel. We usually do, usually will do some tests that include HIV screening, hepatitis B, hepatitis C, syphilis, chlamydia screening, and of course, gonococcal infection screening. So these are some of the tests that will be done for the. Then of course, besides that, we will do a hormone assay. We want to check that this woman's, that the young lady's hormones are within the right proportion, and then there is no hormonal imbalance going on. Okay, so we also want to check that. The FSH level, AMH, even for some people, of course, to check that the woman still has capacity to produce eggs, because this test can actually tell you about capacity of a woman to produce, and of course, even to tell you if, of course, she doesn't even have any at all. Of course, this test can actually show you all of these things. And then lastly, we usually would do some, we do ultrasound scan for the donor. Of course, we have to scan that truly the ovary. So we don't just make decisions as to clearing the person for egg donation or clearing the person to be an egg donor just by using only blood tests. Of course, we also would do other investigative modalities like the ultrasound scan, so as to check the ovaries to be sure that truly this lady doesn't have any condition that prevents her from donating. Okay. So you want to check that. You want to check that, okay, even the lady doesn't have polycystic ovarian syndrome. Because the truth is, if a woman who is a donor, who wants to be a donor and has polycystic ovarian syndrome, of course, that condition alone predisposes her to having a particular complication from that donation process itself. So basically, you want to check that and use that as an exclusion criteria also for that donor. Because you don't want to, somebody willing to do something, you as a physician, you have the right to, of course, do everything at the best interest of that client, protecting her, because, of course, that's our primary aim, to safely perform any procedure, of course, without putting the person at any risk, of compromise in herself or problems of herself. So basically, these are some of the tests that will be done.
Okay. All right, thank you so much for that. 07000 is a number to call. Send us a text or a WhatsApp message to 070 317 56537. All right, so there's a question here, but it's a bit off what we are talking about. But let me just pick this call before it goes off. Hello, good morning.
Hello, good morning, WFM.
Hi, good morning.
Yes, I called earlier. This is Yusuf Olamileko calling back.
All right, Yusuf.
I know maybe it's not in the ethics of doctors who do comes to this program to give us a specific price for such. But I just want to practically ask him, is it the cost of going about, is it more than how much one we use for doing DNA? So if you should give me the range like that, I will know, because I know how much is DNA in Nigeria now. And is it affordable? Yes, so I want him. I know he might not be willing to give us the specific price.
Are you asking for IVF or for egg donation?
Yes,
what exactly?
IVF.
IVF. Oh.
Yes, to do it, yes.
Okay. All right.
Okay. Yes. So basically, the average cost, okay, for having an egg donation IVF cycle right now, okay, in the country usually would range between 1.8 million naira to, 3 million naira or 3.5 million naira. Yes, because it is more expensive doing an egg donation IVF cycle than doing the own IVF cycle. Own IVF cycle simply means people who are using their own eggs and their own sperm, okay, for IVF. So basically it's more expensive because you also have to factor some other things. You have to factor some other things, bring certain things into consideration, of course, including the test and all of that for the donor, okay, and of course some compensation for the donor. Of course, they are taking out time to voluntarily do something for you. So just to compensate them for so there's a reason why I'm a little bit because usually when it comes to this part of compensation, a lot of people, because the law actually frowns against exchange of a particular tissue, okay, in this case now medically, for money. So basically, just to state it out there, donors are not being paid, they are being compensated. Okay, it's just like a compensation, like an allowance for transport and all of these things, inconvenience and all of that. Yes. So because the process actually involves a lot to donate, so basically the payment, okay, everything has been passed into the overall cost for doing an egg donation IVF cycle. So yes, that is why it is that expensive. So it's actually quite expensive compared to the conventional own cycle IVF treatment.
All right, Yusuf, I'm sure that Dr. Bolaji has actually answered you. All right, so Dr. Bolaji, this question is a bit off from what we are talking about, but it's from a woman. So today is Women's Health. So let's see. She said, please, I have been feeling chest pain like 3 weeks now, and something find it difficult to have a deep breath sometimes. Please, what could be the problem? Fumi from Songo. So she's been having chest pain for like 3 weeks now, and sometimes she finds it difficult to have a deep breath, or something like that. So although she's not very explicit on what is going on here or how she's feeling.
On what exactly?
Yes. Yeah. So, but go ahead, doctor.
Well, my advice to her is that she should actually get properly evaluated. Now, when you're talking about chest pain is like a non-specific, well, let me not say non-specific. It's not actually non-specific. It just simply points to the fact that there's something going on in the chest, okay? The pain that she's having can be coming from, most likely, from even the muscle or even from the musculoskeletal system now, even from the bone itself. So basically, when we breathe, when we inhale and exhale, basically some level of expansion and, what's the word now? I don't want to use the word compression, but anyway, something like that happens, okay? Expansion, and then of course return back to normal position actually happens with the chest wall, okay? So basically, if there's some form of costochondritis or musculoskeletal pain and all of that, of course this can also prevent her from having that deep breath, like she says. Another thing, of course, there could be something going on with her lungs, of course. So basically, she want to check, could be an infection, bronchitis, or something, or even possibly pneumonia. Like I said, just saying chest pain itself alone would trick the mind of the physician to think 1,000,001 things. Okay, so that's why I said it's better she goes over to the hospital. She will be evaluated. Even chest X-ray will be done, and even ECG can also be done. ECG now talks about an investigation for the heart itself, because whenever you're having chest pain, it doesn't just point to problems with the muscle or the bones or the ribs. It also could, be pointing fingers towards the lungs and, of course, the heart. And these are some of the structures that are present within the chest wall. So it's very important she gets properly evaluated. Yes, and not just, I think, yes, this is going to be the best way for her to just go back to the hospital, because for some people, they're actually trying to run away from going to the hospital. So, but I think for her, she would benefit from going over to the hospital. 3 weeks is a long time for you to be experiencing such symptoms. So it is important you get serious, visit the hospital, let all the necessary tests be done, chest X-ray, ECG, everything. They would even listen to the chest, with the stethoscope to be sure that there's not consolidative process going on in there. So, just to give her the best management for that problem.
All right. Thank you so much, Dr. Abolaji, for that. Now let's head back to our discussion for today. All right, which is egg donation and what you must know. This is Women Radio WFM 91.7, and of course, this is the program Radio Doctor, where doctors consult for free. Right here on Women Radio WFM 91.7. So let's head on straight back to our discussion for today. We've been able to talk about the medical screening. We'll talk about who can donate and the criteria for it. Now, are there risks and what are the risks and potential complications that could come with egg donation for the egg donor?
Okay, so there's really nothing. There's really no procedure that doesn't come with its own risk, okay, or its side effects. So I will speak about some of the side effects. But before I get down there, let me talk about the egg donation process. So basically, the egg donation process actually involves 3 things, but 2 actually pertains to the donor, okay, to the egg donor herself, and then 1 actually pertains to the person that will receive the eggs. Okay, so basically the first thing that has to be done is ovarian stimulation. Medications, injections will be given to the donor over a period of time, okay, roughly around 12 to 13 days thereabout, okay, roughly. Injections will be given to her. Okay, these injections were actually meant to cause follicular development, okay, inside of the ovaries of that lady. Okay, so we call that the ovarian stimulation phase. And after which, of course, the donor comes in for follicular aspiration, where a suction needle is passed through the vagina down to the ovaries to try to aspirate the fluid, okay, the follicular fluid. That is where you find the eggs of women. We aspirate all those follicles and, of course, hand it over to the embryologist, who isolates the eggs from within this fluid, okay? So while that is ongoing, of course, the recipient would have been taking medications to prepare a womb to receive the embryo that will be formed from that fertilization outcome of those eggs that have been collected from the donor. So basically, that's the process. Now, to talk about the side effects, okay, there are some side effects that will be present. There are certain symptoms, rather, or certain complaints that could be present, okay, before the retrieval is done for the donor. Number 1 is the pain at the site of the injection, because these donors have to take injection over a period of time, like I said, between 12 to 13 days thereabout. So basically, there could be pain at the site of that injection. Okay, there could be some mood swings, fatigue. These are common. These are some of these symptoms even that people would experience when they're about ovulating normally, okay, in the natural cycle. Okay, and of course, breast fullness can also be present. While after the retrieval has been done, okay, because the retrieval process of those eggs is actually like a surgical procedure. Of course, it can never be done in a conscious state. Okay, basically, the lady has to be sedated and taken into theater, sedated, and then, of course, the procedure will then be done. So after that retrieval process, okay, usually the commonest side effects are experienced are vaginal soreness. The vagina becomes sore, feels sore. Okay, there could be some vaginal bleeding or spotting, not really bleeding, more like spotting. Okay, there will be abdominal bloating. There could be pain at the lower abdomen and all of that. Okay, there's even a risk for infection, even though all of these are actually prevented by the administration of antibiotics. Okay, even after the procedure, after the incorrect antibiotics are administered on the spot, or even for a couple of days after the procedure has been done. And of course, one of the I don't know what's the word now, the most dreaded side effect or the most dreaded complication of having egg donation is ovarian hyperstimulation syndrome. It is actually in fact, is a dreaded complication both by doctors, okay, who are not even in fertility practice, and even those of us that are in fertility practice. So it occurs as a result of the unexpected I'm using a word that is relatable to everybody, over production of eggs by the donor. Okay, for some donors, from the scans and everything you've done, you expect them to produce a particular amount. You just give some projections, okay, but then after stimulation and after retrieval, yes, you see that they surpass that number by a far larger margin. Okay, so, and of course, as part of that stimulation process, okay, there's a medication that is given called ECG that is actually given to cause the final maturation of the eggs, and of course to induce ovulation in these egg donors. Usually that medication is the culprit, is the reason why many people would develop this ovarian hyperstimulation syndrome. Now, mind you, ovarian hyperstimulation syndrome is rare, but of course it exists. Okay, it is rare because these precautions are present to try to avert that complication from arising. Okay, and there are certain guidelines to follow. So, but it is rare, but of course it exists. About 4% of people who go in for egg donation will experience an ovarian hyperstimulation syndrome. But these days, the stimulation protocol is so advanced that, of course, you are able to avert that complication from arising. So, just to go over everything again, fatigue, mood swing, breast fullness or tenderness, pain at the site of the injection, vaginal soreness, vaginal spotting or bleeding sometimes, abdominal bloating, pain in the lower abdomen, and of course infection and ovarian hyperstimulation syndrome are the commonest side effects to encounter during oocyte donation.
Okay. All right. Thank you so much, Dr. Abolaji, for that. Now, our time is fast spent, but let's get to know how many times can a woman donate her eggs safely? And
okay.
Yes, and you mentioned age. I think you mentioned age restriction earlier. Yeah.
Yeah.
Yes. Okay.
Yeah.
So we'll just leave that. Let's just know how many times a woman can donate her eggs safely, and then does this get to affect future fertility or hormonal imbalance in the donor?
Okay, so basically, according to the American Society for Reproductive Medicine, basically, they've recommended that a woman should only be able to donate her eggs 6 times in her lifetime. Okay. Emphasis on lifetime, and I'm coming somewhere. I'm going to say something shortly. So basically, that is 6 times. So different facilities, different clinics actually have the recommendation, their set recommendation per year for a donor. Okay, so usually for some clinics, you will tell the donor is giving that restrictions. They won't be able to donate more than at least once in a year in some clinics. For some other clinics, more than twice in a year, and it doesn't go beyond that. Okay, it doesn't go beyond that. And then in total, the donor should not donate more than 6 times in her entire lifetime. So whenever she starts donating, she can just start doing the math by herself that, okay, I cannot donate more than 6 times. Okay, but in this environment, of course, even after counseling patient donors, making them see the counselor and everything, advising them even by the nurses, giving them proper health education, by reason of the compensation that most of them would get. Okay, somebody can donate here in maybe Abeokuta and then goes to Jos to donate maybe in 2 months' time, and then before you know, you see her again at Port Harcourt in 4 months' time donating again. So basically, all of these kind of practices, I'm just trying to state this out there so that if there's any donor, any potential donor listening to this program right now, this is actually a word of caution. You cannot donate more than 6 times in your lifetime, and in every year, the ideal thing is to actually donate just once. Okay, but of course, some clinics still permit at least twice in a year, and that's it. So basically, you should keep doing the math for every time you donate. And then, of course, there is no relationship, there is no studies or no research has been able to prove that there is a long-term detrimental effect to donors, to their fertility potential. Okay, so there's no research that has proven anything. So, and the truth is, most women who donate actually 2 months after they donate, in fact, their fertility potential is so high that most people will be able to get pregnant immediately after donating. So even there are certain precautions to even prevent people from trying to get pregnant immediately, because when you retrieve all those eggs, sometimes you never can tell. There could just be some remnant somewhere in there, and this woman tries to, the lady attempts unprotected intercourse, and then she'll be surprised that she'll get pregnant, within the twinkle of an eye. So basically, these medications that are used for the fertility, for the procedure, okay, in a bid to donate, okay, they actually they sensitize the body, so a lot. So it even increases the potential for people to be able to get pregnant on their own. I mean, for the donors now. Yeah. So it doesn't affect their fertility, and there's no proven long-term detrimental health effect to the health of donors.
Okay, all right. Thank you so much, Dr. Aboloje. This is where we call it a day on the program today. But do you have any last words, maybe for donors and for those who will be receiving these eggs? Maybe just in some seconds.
Okay. So now, basically, I think my advice goes to people who are actually trying to conceive. Now, the reason why I'm saying this is because in the clinic, we've seen people who, for some reason, they've been to the hospital, they've been counseled on trying to, counseled when trying to, of course, when they visit the hospital, they be to try to get pregnant, and then they've been told to use donor eggs and all of that. Most people, at that moment, it gives them a little bit of disappointment, and then, of course, they abandon the procedure. So basically, what I'm trying to say, I know our culture actually, some way or the other, there's this sort of cultural stigmatization for people who use donor. So basically, people who do IVF procedure, they actually conceal that fact that maybe they use the donor because of the way the society will look at them, from even relatives will be like, oh, so you're unable to produce eggs and blah, blah, blah. No, so basically what I'm trying to say is that I think a lot of us should try to get more enlightened about the process, and I think we have to do more in a bid to try to offer more cultural acceptance of egg donation, because this could be the only way by which some people can actually get pregnant. So I think yes, I think it's something that an awareness should be given, should be done in a bid to try to enlighten people so that it becomes more acceptable. Because for some people, the fulfillment that they have in life is by completing their family. That is something that gives them some sense of fulfillment. So it is very important that is taken into consideration.
All right, thank you so much, Dr. Collins Aboloje, for being a part of our program today. Thank you.
Thank you for having me.
All right, to have a great week ahead.
All right, I wish you the same.
Thank you.
Bye-bye.
All right, so that's it today on Women's Health, supported by ACT Foundation. A very big thank you to Dr. Collins Aboloje for the free consultation and advice on egg donation and what you must know. My name is Rose Yusuf Kaiser. Thank you all so much. Do want to stay with us right here on Women Radio WFM 91.7. Good morning.
WFM 91.7.